Which way do I look?
Look at the camera.
Oh, okay.
Hey everybody, my name is Dan. I'm a veterinarian, and this is my beautiful wife, Jordan.
And my name's Jordan, and I'm not a veterinarian.
Jordan was on in a recent video about avian influenza, and it was really fun. Mm-hmm. Yeah. And I think Jordan has a lot of really good insight as just a pet parent.
That's really sweet that you did that, because I feel like you take care of most of our animals.
Jordan and Hazel, our daughter, they're the ones that take care of the chickens and the kids. I mean, I like clean the litter box and feed them, but
well, you have to take care of the litter box right now because I'm pregnant.
Yeah, true. Very true. Okay, guys. So today, I wanted to go over some questions, and remember, I am going to try to organize this. So when you guys ask questions, it can go to our direct email, and then we can answer questions weekly or maybe even every morning before I go to work. Remember, I'm only going to answer broad answers. I'm never going to diagnose your pet or give you treatment plans. That is not what YouTube is for. Our goal here is to really educate you guys and make you more comfortable. And I figured it'd be fun to have Jordan on because it kind of gives a good back and forth with me, a veterinarian, and
yeah. Well, thanks for bumming everybody out first. But then you're not gonna give them the advice
no.
on their
This is gonna be great advice.
Patience. Okay.
But we are trying to do Sundays. We're gonna try to nail down a time. I was super late getting back from church today with our 3-year-old, so we pushed it back a bit. We're gonna shoot for 2 o'clock-ish, 2:30, but we'll see how things play out. Sound good?
Yeah.
Cool. All right. So today I want to start off with. We had 2 questions about Pyometra, and Pyometra is an infected uterus. And when I was working corporate at Banfield, Jordan got to see this.
Mm-hmm. Yeah.
Was it pretty remarkable?
Well, we had just gotten married.
Yep.
And I remember I went to go visit you at work, and you guys had stayed later, and I walked in, and you had this the dog was already finished. You did the surgery and stuff, and you guys had this big thing of tissue.
Yeah.
Pussy tissue.
Yep.
In the back, and I walked back there. I probably was bringing you dinner or something, and you guys were weighing it to see how much it weighed. It was so gross.
Do you remember how much it weighed?
I don't remember, but it was big.
Yeah.
And I remember that's what I learned what a pyometra was.
Yeah.
And it's an infected uterus, and this is why you need to spay your doggies.
Yeah.
Because if they get older, they can end up having this problem. And it always stuck with me, and it's been 11 years now, almost 12.
And I get people that either at the clinic or on YouTube, they're like, I've never heard of this before.
Yeah.
And as a veterinarian, guys, no joke. If you walk in with your doggy and it's not been spayed and it's acting sick, the first thing we do is we assume it's a pyometra. We don't not every time, but if we're legitimately sick, everyone's like, does it have a uterus?
Yeah. Well, can you palpate its tummy and be like, oh yeah, that's a big one?
Usually not.
Okay.
That's hard because you think about this. If you look at the doggy and if the belly to the back, it goes bladder, uterus, colon.
Okay.
It goes up that way. So the uterus is sandwiched between those 2 organs.
Okay.
And then you have all these intestines in there too.
Yeah.
So it's possible, but it'd be pretty challenging.
So basically what you do is you get a list of symptoms, and you're these all match up. This is probably what it is. And then you go inside, and then you usually find an infected uterus.
So a couple things. One, just had a heat cycle.
Okay.
So textbook says we had a heat cycle 2-3 weeks ago. It's prime time for a pyometra.
Yeah.
And then you can have an open or a closed pyo. A closed pyo means it's all trapped inside.
Okay.
The cervix tightens up, it's all trapped. If it's open, it's leaky, and everyone's like, that's a pyo.
Okay.
And the way you diagnose it then is you're going to do blood work and the white blood cell count.
Okay.
Yeah.
Makes sense because it's infected.
It's infected.
Yeah.
So, this would be a fun one. So, a normal white blood cell count for a dog, I like it under 18,000.
Okay.
Usually it sits around 10,000. So think about this. If you have a 5-pound infection in a large breed dog, everyone take a moment. What do you think the white blood cell count would be? Normally?
Okay, so what's normal?
Normal about 10,000.
Okay.
Up to 18,000.
Yeah.
So you have a really infected uterus and you're like, oh man, is it going to be a pyo or is it something else? Because you can have all kinds of things happening in the lower urogenital tract, but What do you think? What would be your number?
I don't even want to throw it out there.
Yeah.
I didn't even know what a normal one was. I'm afraid I'm going to be really off. And plus, I'm really bad at math.
Okay, I'll tell you this. Okay. So a dog with like leukemia, like the white blood cells are just going crazy, okay? Crazy high. Like 80,000 is like 80,000 is crazy, okay? And then remember 18,000 is high normal.
Okay.
What do you think a PIO would be? Like you look at that, you're like, it's a PIO. We didn't rehearse it all, guys.
Okay.
I'm gonna give options. 30. I'm just gonna say it now.
Just say it.
About 30 to 40,000.
Okay.
So it's like double, triple the normal number. But guys, that's like super high. That's like getting close to being septic.
Yeah.
And some of them are like getting septic from it. Oh, sorry.
It'll be easier if it's
like
right
that. Okay. But what we do is we do that, and that makes it pretty obvious. And then we do imaging. So we do like a radiograph and ultrasound.
Okay.
Remember, we gotta look at the camera.
I know, looking at Valerie's comment. Crazy. 80,000?
Thank you, Mallory Rogers.
I know.
Okay, so guys, let's look at our comments here really quick. That the question actually.
It was a good guess now.
Okay, so here's the question. Is it safe to get pyometra surgery in a 13-year-old pug with slight cardiac and lung congestion?
It doesn't sound safe.
It's not safe either way.
Okay.
So this happens a lot in old dogs. So here the simple answer is you don't have a good option.
Mm-hmm.
But by not taking action, you're making a decision for your dog, right?
Yeah.
So this is the way I balance it out. I talk about like if we have heart disease, if we have pulmonic disease or pulmonary disease, and if you don't treat a PIO, they are usually fatal. Like you just gotta treat it. You gotta treat it. Yeah. You gotta do surgery.
Yeah.
Some people put them on antibiotics, but you're fighting like pounds and pounds of infection.
Yeah.
And let's be honest, guys, like it's probably not going to work out well for us. So the answer is you're taking the risk no matter what. If your vet feels like they can safely do it and you have a better shot of survival by doing surgery, you should do surgery, of course. If they feel like we're in a tough spot, I have euthanized dogs for PIOs before.
Oh.
Unfortunately, because like if I get a dog who's like 13 years old and we have all these other problems and I don't think it's safe to put them through surgery and it's going to be hard to recover and like their quality of life is going to diminish, then you're moving towards like, do we have a good quality of life? And we might not.
Okay.
So unfortunately, sometimes we do euthanize, but usually don't.
That just sounds like a long time to like not spay your dog.
So
like,
I agree.
Is that you usually just find it in dogs that are like used to like breed,
and also honestly a lot of people don't realize.
Okay.
They just don't realize it. People are shocked to know that the uterus can go bad. It usually does go bad in dogs. So most people are surprised. Yeah.
So like what age should you spay neuter your dogs?
That is highly debated. That is highly debated. Because a lot of people worry about hormones and bone development and secondary sex characteristics. I like to do it after the first heat cycle, or around the first heat cycle. I don't get too picky in that regard.
Okay.
But I have had dogs on the first heat cycle have a PIO. I've had 2 of them, which is bonkers. Usually it takes multiple heat cycles to get a PIO.
Okay.
So usually I tell people after the first heat cycle, but it varies a little bit. I had another question about a PIO. So check this one out, guys.
Do you have a question for Mallory? Is there something you can? You can do when breeding to prevent this?
So breeding, not really. Just because it's like a big word, pathophysiology of how the uterus cycles through the heat cycle. So you're going to be more predisposed to it after every heat cycle. So a 10-year-old dog is more predisposed to a PIO than a 1-year-old.
Okay.
But aftercare, no joke. Usually you take these uteruses out and the dog feels amazing. You are going to do IV fluids, IV antibiotics. You're going to do a lot of post-op care. But honestly, if you do a PIO at like 9 in the morning, a lot of them, especially the ones that are healthy outside of the PIO, get to go home like the same day. And you know what, honey? I'm going to have you look at those because I struggle to like do both. So here's there was another comment that another question, I should say, not comment. And this person commented and they said, like, I spent $4,000 on the pie surgery, and a spay is only like $300.
Okay.
So this is something that I do bring up on a regular basis. There is a significant price difference between a pyo and an infect and a normal uterus. So spays are uncomplicated. There's not antibiotic IV. Post-op care is pretty minimal. So for the most part, it's small incision, quick procedure, very few complications. We're back on our feet in like an hour, going home in 3 to 5 hours. So
I think you just answered Sean's question, because his question was what specific post-operation care instructions should someone follow up at home?
Oh, yeah. Most veterinarians will send you home with oral antibiotics, oral anti-inflammatories, pain meds, that kind of deal. It is really a glorified spay. So you need to make sure the infection's under control. But outside of that, surgically, these doggies heal up relatively quickly. Yeah. Did you have any thoughts, any questions on it? I know, I feel like it's something that like we talked about that first time when you came in, we were dating. We were married. We were married. And then after that, it's like something that you remembered really well.
Yeah.
Once you see an infected uterus.
It was huge. It changes your life when you see an infected uterus. Yeah.
If there's no other questions there, I do want to jump to another topic. Hypothyroidism in dogs. Hypothyroidism in dogs is quite common, and it will cause a lot of weight gain, a bad coat, chronic skin infections. And it's something that when I joined your family, your doggy had it.
Yeah.
Yep. She was like overweight, had poor skin.
She was like losing a lot of fur on her tail, and she was like wasn't moving around the best. And then when you came into the picture,
I saved the day.
Yeah. And I remember it's right when my parents moved from California to Wyoming. Yeah. And she was like a puppy. I felt like when they went out there because she. Yeah.
So hypothyroidism is usually immune mediated. Yeah. So the thyroid gets beat up a little bit, the thyroid levels drop, and the doggy develops hypothyroid issues. The big things here is weight gain, a poor coat, repeat bacterial or yeast infections of the skin and the ears. And this is something that is quite common and can be easily diagnosed with just a T4 test. Sometimes they do a little bit more than that. And if you have other underlying problems, you could have a euthyroid 6 syndrome, but that's a little more complicated. Yep. Cool. And the last things I want to hit on was vestibular disease. And we had a question about vestibular disease and what it looks like in older dogs and how quickly it gets better. This person went to the emergency room for it.
So this is like when they like lose balance.
Yep.
Okay.
Yep. So the middle ear has a vestibular system. Okay. And it's kind of like these cilia, and they float, and they kind of allow for the dog and for us too. I mean, God made us all pretty similar. It allows us to stabilize ourselves. Okay. And see the world like straight on. Okay. So when a dog gets vestibular disease, and usually it's idiopathic, we don't know why it happens. It will make the world just tilt a little bit. Okay. And these doggies will have a head tilt. They'll have something called a nystagmus. That's where the eyes bounce. Okay. So literally, I had one on Thursday. That day I came home late. Sure. And the doggy, they thought it was something completely different. And the dog came in walking like this, and eyes were bouncing, and the head was tilted. And without doing any blood work, it was like, that's vestibular disease. Okay. Of course, you're going to do some blood work to make sure you're not missing anything. But idiopathic or unknown cause for vestibular disease for the middle ear is pretty common in older dogs.
Okay. So what do you do for that?
We usually hydrate them because either they're throwing up or not drinking very well. Okay. So we get them really hydrated, usually IV fluids for the really weak ones, sub-Qs for the ones that need some maintenance care. And then we'll give them some nausea medicine. And This is debatable. Some veterinarians will treat for possible inner ear inflammation or infection, but that really kind of varies. But I've become more prone to hydrating and nausea medicine because it's like on a cruise ship, and the road's just like boom, boom,
Okay.
boom. So once you control that, allow them to bounce back in the weeks to come. Yeah. Let me see here. Well, that was good. That was fun.
Sean says, what are the specific signs of hypothyroidism to look for in your dog?
So honestly, one of the most common reasons to run a thyroid would be the two we touched on briefly would be weight gain. That's huge.
Mm-hmm.
But you know what? Everybody with an overweight dog thinks their dog has hypothyroidism.
Oh.
And usually you just feeding your dog too much.
Yeah.
So usually what I do is I'll be like, how much do you feed your dog? We'll talk in depth about it.
Yeah.
And then if everyone's on the same page and we're like, yeah, I definitely don't overfeed my dog. I'm like,
okay.
Great. Let's do a thyroid. And we'll do a thyroid and it comes back normal. I go back in the room and I go, you may overfeed your dog. So it's not too bad. Most people get it. So all we do is we adjust the food. You know, dogs, just like people, the metabolism can be vastly different among doggies. So it's one of those things where you may have a dog of the same breed and the same size, but the metabolisms are different. Their calorie burn per day is different. So we just need to adjust our calories in a little bit.
Okay.
And then number two, chronic skin issues. Like your family's doggy, Maggie, she had Brie. Thank you.
Yeah,
Maggie's a new one.
Yeah.
We had really, really bad skin. And the really bad skin is from the lipid bilayer that's not being as healthy. So once you fix that,
lipid bilayer.
The lipid bilayer.
Okay.
Yep. These are the conversations we had after I come home from work.
I don't know.
And she really enjoys these.
I don't know why you think I know what that is.
You got anything else for me, honey?
I think that's it.
It sounds good.
Thank you, Uncle Sean.
All right. So everybody who watched, I appreciate it. We will try to get more organized with this. It was really fun having my wife Jordan hang out with me. And as always, guys, I'm Dan, I'm a veterinarian, and appreciate you watching. You guys take care.